How can a hair transplant be made successful? Good morning, guys. When we talk about hair transplantation results, the most popular and interesting question would be, how can a hair transplant be made successful? This is a question comes into their mind, and that I really wanted to make a video. Kindly watch the video until end to understand what are the steps that ensures to make your hair transplant successful. We'll discuss in detail. Well, how can hair transplant be made successful? Let me discuss in two parts. There are two important scenarios. Scenario one is, what are the patient side views or parameters one should see, and what are the doctor side parameters and criteria one should see to make hair transplant successful. Because everyone cannot undergo transplantation. Most of the youngsters are thinking that without knowing are they really good candidate for transplant, whether we can do transplant or not to such patients, they're just going to some clinics and getting done their transplantation. So that is basically a wrong criteria. So let us start with the patient criteria. So most of us youngsters, they think that because I'm losing more hair, I tried PRP, I tried minoxidil, I tried many things, nothing is worked out for me. That's the reason I really want to go to transplant. That's the one basic reason I always hear from patients. Number two, because I'm using helmet when I'm riding my bike, I can see my forehead is larger. So that is the reason I want my transplantation. That's the second reason I'll most commonly hear. And third one is, I had very good hair earlier. Now I'm losing hair everywhere. That means their total overall density will go down, their volume will reduce. Everywhere the volume of the hair in the scalp, not only in the front, it comes down. Because of that reason, I really want to go to undergo transplantation. These are the most of the criteria youngsters are thinking and looking for the transplantation, which is totally wrong. With this kind of expectations, if you go to some clinics, they'll put you under their knife and you undergo transplantation with no results. End of the day, transplantation would be definitely a failure for you. So kindly question yourself, are you a good candidate for transplant or not? How do you question yourself? So basically, kindly look at the age less than 25, do not undergo transplantation. The reasons are, your hair fall is not stabilized. You'll be in phase of ongoing hair loss, thinning. That's not the right age to do the transplantation. So number one criteria. Number two, instead of asking the clinics or doctors, what is the cost of the transplantation? Rather ask them, am I a good candidate or suitable candidate for a transplantation surgery? So most of the people ask me immediately, so what is the cost? That means you are choosing the transplantation on the basis of the cost, though you are not a good candidate for transplant. That puts you into definitely a failure outcome. So rather asking about the cost, ask about whether am I a good candidate for doing transplant? Would that help my situation to get the hair back? If not, look for other alternatives. There's no point directly insisting yourself getting into hair transplant surgery, even though you are not a good candidate for eligible candidate for a transplant. While it comes to PRP, minoxidil, all these medications and other treatments, multivitamin therapies, I'm sure that would help you to reduce the hair fall. Certain extent, you also can get the hair back, but it will not help you to get the hair in the male pattern baldness. So, to get it done your transplant, to become an eligible candidate for a transplant, you should have either stabilized hair fall pattern or established baldness. Otherwise, you are not a good candidate for transplantation procedure. Without having a stabilized hair fall pattern or established baldness, transplantation is not possible. So there is another criteria from the patient side. One should look at it. Then, if you have any doubts about it, kindly visit some clinics, good doctors. Ask them instead of asking the cost and techniques. See, worldwide there is only one technique, micro FUE, but clinics will give you different nomenclatures to confuse you, where end of the day, to convince for the procedure. Rather going that way, a direct question to your surgeon or your doctor, am I a good candidate for a transplant or not? Then you will get some idea. If not, you can think about taking other remedies. So with these three criteria, you can select good clinic, and you can definitely think about hair transplantation. That is the first and important step for the patient side. Without this, probably you would undergo transplantation, though you don't need transplant. Obviously ends up in a failure outcome. This is the first step on the patient side. Well, there is another criteria called diffuse pattern hair loss. Usually, they don't go completely bald, but their volume will comes down year by year. They never have the volume that they had in younger age. That also lead to kind of psychological aspects to them, and they'll think about hair transplantation. Well, kindly consider not doing transplant right away. Talk to your doctor. If your age is about 25, you got a diffuse pattern from since couple of years. There is no change that has been happening year by year. You can think about getting it done. If not, if you do transplant in such scenarios, again you will lose more hair. It doesn't make any sense. Okay, so there is a kind of this kind of things has to be decided by your doctor. This is another criteria for the patient side perspective, thinking of the transplantation. Okay, rather directly going into transplant and asking someone that I want transplant, kindly give yourself time to your doctor to understand, and you try to understand yourself what kind of patient am I? Am I eligible to transplantation or not? What are the pros and cons? Then you will get a clear picture of your transplantation idea, and then goes about cost and other things.